Back pain can be really difficult, whether it's caused by a herniated disc, whether we've just got back pain or we're getting sciatica down into the leg. It can be confusing. And for many of you guys that watch our channel and that are members of the program, we talk a lot about engaging a neutral spine, focusing primarily on that spine, not moving into positions like flexion in particular. But the question naturally gets asked, well, the spine is supposed to move in all directions, isn't it? So why are we avoiding flexion? And if we understand that we shouldn't perhaps do it right now, when can we add it back in? And that's what we want to cover in today's episode of the podcast. Give you guys a framework, a few pointers, checklist, if you will, to help understand when we can consider whether adding flexion into our practice is going to be useful for our specific circumstances, so that by the end of this video, you're going to have a clear idea in your mind about why and when this is going to be appropriate, if at all, for you. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape. We help people around the UK and all over the world fix their back pain from home and get back in shape for the long term. And today, hopefully, will be a short and sweet video giving you some tangible points that you can reference along your back in shape journey. To help set expectations, there are going to be two main considerations that you're going to want to take, and I'll briefly discuss the implications of those considerations afterwards and then kind of go from there. So first and foremost, the main consideration we're going to be aiming for is going to be to do with axial loading. That is being able to bear load in the real world. And the standard that we find we are regularly recommending patients and members is actually based on some of the research from Dr. Peter Attia, or his standards, where he talks a lot about the standard for an adult aged 40, male being 100% and female being 75% of their body weight, being able to farmers carry this for a period of 1 minute. And what we've done is taken this figure and applied that to the squat or the hip hinge. And so the goal here is to be able to perform a good technique-based squat or hip hinge with that amount of load for you for 10 reps without having any trouble, pain, or aggravation. That first goal is giving you an ability to assess the spinal disc's tolerance for load in the neutral position. Once we have achieved that, we've progressed with our rehab up to that point. The next thing to consider is going to be the amount of mobility that we have in our hips. Is it average or greater than average? And where it is not, work towards the obtaining of average or greater than average hip mobility in all ranges. So what does this actually mean? Well, make no mistake, long before you reach those sorts of levels, you're going to be in a significantly better place. And I would argue you don't actually need to reach those levels in order to be pain-free and get back into doing the things that you want to do. But what does it mean? Well, the loading component means that your spinal discs, the annulus fibrosus, the segments, and your skill and competence are capable of bearing a significant known amount of load without trouble or failure. It means that you have significant control over real-world movements, the hip hinge and the squat, at such a level that you are really going to be very resilient to other things putting you off guard or putting you in a position of vulnerability. It means that the muscles of the core and trunk region have both coordination and significant strength to support that spine, which itself is strong too. It means the muscles of the lower body are also stronger and capable of working in tandem with your midsection, creating a really robust and resilient structure from the midsection all the way down. By this point, we also will have practically autonomous, we don't have to think about it, movement patterns that are also going to serve us outside of the gym environment. And if you're working out at home, this just means the lab or the gym, or the place that you're working out, the controlled environment where you can control more or less all of the variables. And as it pertains to the hips, the hip joints are strong or stable in all ranges. You might be mechanically more weak at the bottom part of a squat or hip hinge, but the joint itself, its architecture, it's a ball and socket right in there. It's strong in all ranges. As opposed to the spine, the further we get forwards or backwards, the more force, focus, and localizes to certain parts of the spinal joint. And so by having strong and very flexible or adequately flexible hip joints, we can allow our hip sockets to take up more the range of motion from day-to-day activities, so that our spine needs to come in and add that extra bit of movement, such as when tying our shoelaces, at a later point, and therefore less spinal mobility is required, or less spinal compromise is required in our daily movements. This is just about simple, good, healthy movement habits. It is at this point that we can now start to consider the need for additional flexion training. And there are going to be a couple of considerations here that you're going to want to ask yourself. I've done the previous steps. I've got the axial loading down. I've got really good hip mobility. Now, do I need more flexibility in my spine? Let's have a think. For some of you guys, like myself, perhaps you engage in sports such as jiu-jitsu or combat sports or other activities that are going to put your spine in precarious positions. And once we've got this baseline, it does make sense for you to work strengthening in those particular ranges of motion. So adding in things like Jefferson curls, for example, to really challenge that flexed position can make sense here. Of course, they should always be done conservatively, but you know you've got a solid base at, let's just say, 100% of your body weight. You're happy with that. So it's a very, very conservative test to now start looking into Jefferson curls with 5 to 10 kilos. Or even body weight, to explore how things go. And we apply the same principles, which should be pain-free, but it makes sense that we would do that because, for example, with me in jiu-jitsu, it could be a very real circumstance where I'm folded in half by someone that weighs 100, 120 kilos on top of me, putting significant stress and strain through my discs. And so it does make sense, if I've got the time and I've got the basics in place that we've discussed, that I might consider adding in some element of loaded flexion or other movements to strengthen me in positions away from the neutral. But I'm building that on a base of strong neutrality. I'm not starting this movement or this practice when I'm only able to squat 10 or 15 kilos. The next consideration is, do you actually have currently normal amounts of spinal mobility? Do you need to increase the amount of range of motion in your spine? Do you actually have the ability to do flexion? Do you have the ability to do extension? There's not as much at the lumbar spine as you might think. And in the accompanying article here, we're going to put down, so link down in the description, some references to actual segmental ranges of motion, particularly with flexion and extension, down in the description. It's not a lot. And when we think about other movements, I'm thinking things like thread the needle, for example, where we think we're improving things like spinal rotation through the lumbar spine, perhaps. It's not that much. Most of the rotation will go through the thoracic spine due to the way in which the lumbar facets are orientated. We don't have that much lateral rotation either, or side bending, one way or the other. So understanding this and then being objective is going to be really important. Do you have the appropriate amount of extension and flexion in your lumbar spine already? If my elbow can bend to here, I don't need to add more extension and get it to go backwards. That's just unhelpful. And there is a trend at the moment on the internet of people, quite frankly, building a degree of hypermobility into the spine and into other areas of the body beyond what is necessary. And for your personal objectives, that might be fine. That might be something you want to do, but at least understand it's not something that is required for a healthy human being. The next consideration is, how often during the day do you actually move through that range of motion? Mobility exercises 100% make sense when they are targeted to your specific needs. Otherwise, we're just wasting time. Do we spend, like so many, the average adult, spending 9.5 hours a day sitting every day? In which case, there's a very good likelihood that there is elements of lumbar flexion leaking into your lower back on a daily basis. Are we being targeted with our requirements for spinal mobility? Or are we just adding in general stuff because we don't want to go through the details of finding what am I actually lacking and what do I need to do? If we do that, it's a little bit of work up front, but it means that our stretching or our mobility work at this time is going to be much more targeted to our actual needs rather than wasting time doing more of something we're already doing every day. And if you've answered all of those and the answer is still yes, do you know what I could do with a little bit more lumbar flexion? Then have at it. Test it carefully, make sure it's within pain-free ranges and it's not aggravating you. I would strongly advise against doing it as a warm-up before we do any sort of strengthening or load-bearing exercises, but have a go and make sure it's something that is not aggravating you for the short, medium and long term, and that is not causing any pain whilst you're doing the exercise or practice itself. Things like the cat's cow, child's pose, and other sorts of mobility exercises that you might choose to do to focus flexion through the lumbar spine, if, again, you have checked all of those previous boxes, might be something that a small number of you find is necessary to help improve your overall back health. But I think by that point, for almost all of you, if you have adhered to and checked the other boxes first, you won't even be thinking about the need to add in flexion or anything like that, because you won't feel there is a need, because you'll be so much better off. Your hips will be healthy again, your knees, your ankles, they're all working fine. And you don't need to go and add in more spinal flexion. I think there's a very, very small section of the population that might well need to add in some more spinal flexion. But for the vast majority of us, especially with modern day life, it's something that we do plenty every day anyway. We don't need more of it. And when we are dealing with our recreational time, to do things to improve our health, maybe get some cardiovascular exercise in, maybe do some strength training, maybe do some other bits and pieces. Those things are to provide us with the things that are missing from our daily life. And mobility work can be absolutely fantastic if it's used in a way that is trying to fill a void of something that's lacking. And I think for flexion in the lumbar spine, in modern life, for most of us, it's not something that's lacking. It's not something that's particularly limited. And the only limitations that we have in the early days on our flexion are because we have a weak back. Hence why I said at the very start of this video, those standards need to be adhered to first before we start looking at this. Hopefully you found this video helpful. At the end of the day, those sorts of targets, particularly with the spinal axial loading, are something that's going to take you a good amount of time to achieve in many cases. But in the pursuit of that, you will find that things get better and better long before you get anywhere near those kind of targets. If you want any more details on some of the additional caveats beyond this video, then always check out that link down in the description for the full article where we will go through things in a little bit more detail for you and flesh it out a little bit more, as with all of our articles. So you can check out the detail down there in the description. And if there's any other questions or anything like that, you can post down in the comments. Thanks for watching, and we'll see you in the next one.